Anything else?
Yeah, does Fraser have this system interfaced with any of its other ADT?
The only interface that we have right now is with the RAI data, where actually we'll go and upload the information that's collected in RAI and that brings it into the dashboard itself.
The 2.0?
Yeah, 2.0 uploads the, and we haven't shown the clinical indicators yet. But
Let's go there. It's the last. That's the last piece I wanted to show.
that's where there's some integration is on that. So what you're seeing there is RAI data being collected and being uploaded into the dashboard.
Okay, so there's a separate entry process here for
Yeah, the data is collected as per 2.0, and we're happily collecting the data, not say onto CaiHi, because we don't think we have a legal right to move to CaiHi. But we are uploading the information into the dashboard purposes for pathways. So we can set them up as performance indicators. Right?
So these are this is the screen for the clinical indicators, and this is collected on a quarterly basis from each facility entering into pathways. I've got one example here. The number of falls that have resulted in an injury, just as an example, as Keith alluded to earlier. So these numbers are collected every quarter and are stored in pathways, and this is just a graphical way to represent them. You can see there's quite a wealth of information that we collect at that level, and so this is just another way that we can get that information out.
And like I said, falls is not going to be benchmarked. It's more about collecting the data, identifying where sites are having lots of falls, and then start to bring some clinical interventions there to start to bring that down. But we're not going to benchmark it, we'll hold people financially accountable for that, because we want to encourage the report of as many falls as possible, because it'll add to the richness of the data set.
So you're encouraging them to report a self-reporting system?
Yeah. And a lot of the falls are most falls actually are not witnessed. Most falls are not witnessed.
Okay, so my
we
safety coordinator hat on. So when it's self-reported, is there not the worry that then they would stop reporting? Like if it's CaiHi data and it's admissions and it's driven from when they went to emerge and what that finding was, it's different than a self-reporting system.
Yeah.
Whereas you may want to see more actually reported, because then you know the intervention's going on and that attention to that that is there.
That's we have to sell that this is good practice. This makes sense. So let's work on a collaborative basis to develop clinical interventions that make sense, so your residents don't fall as much, they don't show up and emerge and have their lifespan short because of that. And as I said, we've done that in assisted living and have had tremendous success in some pilot experiments we've had, actually bringing some interventions to bring down those fall rates. And the falls actually are substantially more in assisted living than they are in residential care. Substantially.
Well, the reporting would be because they have longer hallways.
The population is different. They're mobile.
Yeah.
Absolutely. And they're cognitively intact and they're mobile. So they're falling more.
Yeah. They're trying to live.
Yeah.
Any last questions? If anybody's interested in getting a more personalized demo, just come up and talk to me after. I'll leave you my card and be happy to set something up. Just in closing, I'd just like to say it was a great, we learned a lot, myself and anybody else that was involved in the project as a result of Keith and our partnership. And be happy to share more details if you have any other questions.
We'd like to thank Strata Health as well. They did this on a collaborative basis. It's turned out to be a fabulous tool. We see nothing but growth and potential with this. I think it's going to keep on getting bigger and bigger, I think, in some ways. And so it's been great for us. We're really expecting some really... the last thing I wanted to say, we're actually going to do an evaluation of this particular tool to see how it affects outcomes. And so we're just having our researchers actually set up an evaluation model. So the tool goes into place, the users use it. We have our interventions, which are my people making phone calls and asking what's going on. And then in a year's time, go back and look at the baseline data, which we have today, to see whether or not we saw significant statistical movement in some of these key performance indicators that we think are important.
Thank you very much. Thanks, everybody.